Hello, my name is Daniel Aloise. I'm a medical student from the Florida International University, Herbert Wertheim College of Medicine in Miami, Florida. Partnered with Dr. Adam Memon from the Baptist Health South Florida Hospital and Anna Zaldivar, fellow medical student from FIU, we created an article entitled Don't Drink That! Diquat Herbicide Organophosphate Poisoning and Multi-Organ Failure, a case report. This case report is centered around diquat, which is a rarely described toxin that functions as an herbicide used to control both terrestrial and aquatic vegetation. We had a landscaper present to our emergency department about 90 minutes after he unintentionally ingested an herbicide including diquat, which led to both organophosphate poisoning and multi-organ failure, secondary to formation of reactive oxygen species. We seek to describe this uncommon instance of accidental diquat ingestion, including therapeutic regimens and course of disease progression. So we had a 63-year-old male present to our emergency department about 90 minutes after he ingested a small gulp of Tribune herbicide, accidentally from a Gatorade bottle, which he did not know contained the herbicide. He experienced a burning sensation in his throat and sternal area, soon after followed by nausea, vomiting, uncontrollable urination and diarrhea, as well as weakness of his legs. When he was admitted to the hospital, on physical exam, we saw a man in moderate acute distress, diaphoretic with severe epigastric discomfort. The emesis was clear while the diarrhea was watery and neon green, neither showing signs of blood. He lacked bronchuria and his pupils were normal in size. He was hemodynamically stable on admission, and his labs were notable for an elevated lactate at 3.0 and white blood cell count of 14.7. We immediately consulted poison control, who called for decontamination of the patient and his belongings, followed by emergency dialysis. Atropine and pralidoxim were recommended as needed to combat the cholinergic toxicity as standard for organophosphate poisoning. Those are used for the secretions and muscle weakness, respectively, as pralidoxim works on the neuromuscular junction. Activated charcoal would have been used to detoxify the gut had the patient arrived within 60 minutes of toxin ingestion, rather than 90 minutes. Despite exhibiting several signs of organophosphate poisoning, including diarrhea, urination, and emesis, as I mentioned, the patient did lack bronchuria and his pupils were normal and reactive to light, so we did not even have to use atropine for the secretions. Within 24 hours, the patient did, however, show signs of kidney and liver damage, despite continued dialysis and now use of acetylcysteine and dexamethasone. On day 3, he suffered generalized tonic-clonic seizures and developed new-onset atrial fibrillation and confusion in the setting of acute toxic metabolic encephalopathy. On day 4, our patient exhibited new-onset dilated pupils, and he was subsequently taken to get a CT of his brain, which revealed diffuse cerebral edema and toxic encephalopathy with cerebellar tonsillar herniation and mild hydrocephalus. He became hypotensive despite pressors and demonstrated progressive neurological deterioration accompanied by loss of his brainstem reflexes. Following discussion with his family, he was unfortunately transitioned to comfort measures only. He would be pronounced dead on hospital day 4, secondary to cardiac arrest. So what happened? Not only did the organophosphate happening occur, but we saw multi-organ failure secondary to reactive oxygen species. Diquat is a potent redox cycler with its toxic effects dependent on its ability to undergo a single electron addition to form a free radical. Utilizing NADPH and cytochrome P450 reductase, the diquat radical formed is highly unstable and transfers an electron to molecular oxygen to form a superoxide anion radical, which is a highly reactive oxygen species. Continuously cycled in this process of oxidation and reduction, the superoxide anion radicals produced react with each other to form hydrogen peroxide and molecular oxygen. Under normal physiologic conditions, our body is able to detoxify this hydrogen peroxide. However, our protective mechanisms can become overwhelmed and lead to lethal consequences for the affected cells, especially the liver, kidneys, and lungs. Our patient suffered multi-organ failure as a result of these reactive oxygen species. Diquat is rare, yet highly lethal, and forms these superoxide anions via the single electron addition. Characterized by initial organophosphate poisoning, early symptomatic treatment focuses on combating the cholinergic toxicity with atropine and pralidoxim as needed. This case demonstrates the need for educational awareness and additional research to be conducted on different treatment methods for diquat and other related poisonings that result in oxidative stress on the body. Thank you very much.